the first wave of change from genomics and biotechnology are going to occur in healthcare and medicine, I believe. They're going to arrive over the next couple of decades as this sort of tidal wave of genomic information for all of these cheap gene chips and stuff begins to begins to wash over us. And the kinds of things that are going to occur is, number one, we're going to move towards a medicine that is much more predictive, that is much more personalized, and that is much more oriented towards prevention. Now, the most talked about aspect of that is pharmacogenomics. Pharmacology, drugs, and genomics, genetics, are personal biochemistry, so the tailoring of drugs to us as individuals. And this is just beginning to arrive. It's an example is Genentech's Herceptin, which is a drug for breast cancer, and it can be targeted through genetic diagnostics to patients who are overexpress a particular protein called the HER2 protein, and it's a very effective treatment for about that 25% of patients. Similarly, if you monitor the activity of cytochrome P450 enzymes, you can identify variations in metabolism of drugs and such, and that can be used in determining dosing levels that are more effective. So very important stuff just beginning to occur there. Nutrigenomics, the targeting of the nutrition that we eat for us as individuals. Frankly, that's a lot more hype at the moment. It's because the nutritional relationships are too complex for easy genetic dissection, at least at the moment. But I think it may become important in the future because there are big differences. Genes do matter, and there are very big differences in the incidence of a lot of diet-related diseases in different subpopulations of humans. The most easy one to see that with is type 2 diabetes, or a common one, where the non-Hispanic white population has an incidence that's about, I think, 7 or 8%, and Native Americans have an incidence of 37%. I think in PIMAs it's 50%. We just have to remember, though, when we talk about this sort of targeting, that 90% of health problems that are associated with nutrition today can be addressed by exactly the same advice to everybody. And Marion Nestle had a nice way of putting this: eat less and move more. Not so hard. And you could add to that, you eat more plants, fruits and vegetables, less processed foods, take a multivitamin. You do that, you're in great shape. Well, if it's so simple, why doesn't everybody do it? Because we know it's a long way between knowing and doing.